Hello there and welcome to the channel. I'm Stephen Bunting and I'm a physiotherapist working in the northwest of England. For more information about me and all the other MSK conditions I've covered so far, check out the website PhysioMSK.com. Today's video is about Mortons Neuroma, which is a common cause of pain in the forefoot. As with all my patient information videos, I'm going to discuss the condition by addressing the three most common questions that patients ask after they've been diagnosed. Number 1, what is a Mortons Neuroma? Number 2, how come I've got one? And number 3, what can I do about it? Okay, so on to question 1. What is a Mortons Neuroma? Well, the word neuroma comes from the ancient Greek, with neuro referring to nerves and oma meaning growth. So neuroma means a nerve growth. Mortons refers to the American surgeon who first described the condition in 1876, Thomas George Morton. More correctly though, it should really be called a neurofibrosis, as the condition is actually a fibrous thickening of the nerves between the toes. And it must be stated that this is a benign nerve fibrosis that is not a malignant growth. People with Mortons Neuroma will often report feeling like they have a stone in their shoe or that they're walking on a marble, but the main symptoms are pain and sometimes tingling, pins and needles and numbness of the toes. It most commonly affects the nerve between the third and fourth toes, and so if you look down at your toe from this angle, this is the area where the symptoms are usually felt. But any of the digital nerves can be affected and therefore symptoms can affect any of the toes. Symptoms are always aggravated by standing and walking and will always ease with rest when the foot is off the floor. Okay, so now we know what a Mortons Neuroma is, let's move on to question 2. How come I've got one? Between each toe is a digital nerve. These nerves are slippy in order to cope with the friction of the toes moving against each other. If this friction becomes excessive and persistent, then the nerve will start to adapt and thicken its external membrane. This is the process of fibrosis. Of course, a thicker nerve is then more likely to become squashed in the first place because it's now thicker and occupies more space between the toes than it should do. And it can then become inflamed and swollen, which further increases its size. So what causes this excessive friction between the toes in the first place? Well, it usually comes down to footwear. Anything that squeezes the toes together can cause a Mortons Neuroma, and shoes like this, worn persistently, are often the culprit. As a result, Mortons Neuroma has been found to be around 10 times more common in women than in men. While footwear is by far the most common cause, some sports and activities that involve jumping or standing on tiptoes repeatedly can also cause the condition. Also, anything that alters the normal bony anatomy of the metatarsals can irritate the nerve and cause fibrosis, such as fracture or osteoarthritis. An X-ray can check the shape of the metatarsal bones to see if this is an issue. One of the tests that clinicians use to help diagnose the condition is the Mulder's test. This involves squeezing the toes together with one hand while moving each individual toe up and down with the other hand. A reproduction of pain or a clicking sensation as the swollen nerve is squashed between the toes is considered a positive test. However, the main way the condition is diagnosed these days is via an MRI or an ultrasound scan, which can image the neuroma and measure its size. Right, so let's move on to the last question. What can you do about it? What are the treatment options? Well, if you've been following so far, you will have no doubt worked out that a change in footwear is going to be the single most important thing that you need to do. Avoid at all costs any footwear which squeezes the toes together. Anything with a heel is also going to be a problem, but you will know this anyway because you will no doubt have already worked out which shoes hurt you and which shoes don't. Generally, a shoe with open toes or a wide toe box is going to be your best option. Some people will also go up a shoe size to find something more comfortable. The next self-help treatments are the orthotics. Various types are available, but the ones which support the transverse arch of the forefoot are likely to be the most helpful. Mortons Neuroma pads or insoles with a metatarsal dome can be helpful for some people, especially if you have a very flat foot. I'll put some links to the different products available in the description below and on the website. You could also see a podiatrist who can assess your individual foot posture and provide something tailored to your foot. Anti-inflammatories might also be worth a go, especially during the early stages when the nerve might feel inflamed or if you're getting any resting pain. The gels or creams are unlikely to penetrate to a depth where they can be helpful, and so the tablets such as ibuprofen are a better option. Taken for a few weeks at maximum dose can be helpful in some cases. Just make sure you check with a pharmacist or a prescriber that you can take them, as not everyone can take anti-inflammatories. Okay, so that's about all of the self-help treatments that carry any evidence and therefore that I can recommend. The idea of all the things we've discussed so far is to try and reduce irritation of the nerve and ultimately reduce any swelling or fibrosis around the nerve. I'm now going to talk about some of the additional treatments that an expert clinician can provide if your symptoms don't settle down to your satisfaction. And the first is a cortisone injection. For a persistent Mortons Neuroma, this is usually the next thing to try. Cortisone is a steroid which is injected between the toes and aims to reduce swelling and inflammation around the nerve. It can often be very helpful, but if the neuroma is large and fibrotic rather than inflamed, then the result might be short-lived. Other specialist treatments that I'll briefly mention, but are beyond the scope of this video, are alcohol injections, which aim to shrink the neuroma, radiofrequency ablation, and minimally invasive cryosurgery, which are all topics in themselves, and I'm not going to cover them here, but there's plenty of information around online if you're interested. Surgery is the last option, and depending on the size of the neuroma, this either aims to remove tissue from around the thickened nerve or just remove the whole nerve itself, which will hopefully resolve the pain but will leave a permanent area of numbness around the affected toes. Of course, the other option in persistent cases, and the one which my own mother chose, who still has a Morton's Neuroma, is to just leave it alone and follow the footwear advice that we've already discussed for the long term. And many people, particularly those with mild symptoms, will be happy to do this. Okay, so that's your whistle-stop tour of Morton's Neuroma. Do check out the website for more information. Thanks very much for watching, and bye for now.